emphasizes the importance of regular and frequent measures and integration of clinical judgment with experience and the potential for accentuating circumstances which can influence accuracy of the monitoring system. So it is emphasizes the meddling of physical science with instrumentation. The objectives are it intended to encourage the quality patient care. It is applied to all types of anesthesia like general anesthesia, regional anesthesia, and even for monitored anesthesia care. It may be extended any time based on the judgment of the anesthetist. There are two standards, standard 1 and standard 2. Standard 1, the objective is that it emphasizes the importance of clinical observation and to modify anesthesia care based on clinical observation. Requirement for standard 1 is a qualified person should be present in the OT during general anesthesia, regional anesthesia, also for MAC to monitor the patient continuously. And if there is any known direct hazard to the anesthetist, for example, some radiation or anything, some provision for remote observation is to be made. And if there is any emergency which requires temporary absence of anesthetist, judgment exercise to compare the emergency with the anesthetized patient condition and in selection of substitute during the temporary absence. This is standard 1. Moving on to standard 2, it constitutes standards for evaluation of patients, oxygenation, ventilation, circulation, and temperature. So 4 parameters. For oxygenation, the objective is to ensure adequate oxygen concentration in inspired gas and blood during all the anesthetics. And for measuring the methods to monitor the oxygenation are assess the blood oxygenation using pulse oximetry, adequate illumination and exposure of the patient to assess the color of the patient, and use of oxygen analyzer with low concentration alarm limit during general anesthesia. Second is ventilation. The objective is to ensure adequate ventilation of the patient during all the anesthetics. Methods are clinically C, chest exertion, movement of the reservoir breathing bag, and auscultation of the breathing breath sounds. And next will be sufficient ventilation to be assessed by clinical signs and EtCO2, and ensure correct placement of endotracheal tube or LMA with clinical assessment and identification of carbon dioxide in the expired gas. Continuous monitoring of EtCO2 from the time of ETT endotracheal tube or LMA placement till extubation. Monitor the tidal volume, and when we are using the mechanical ventilator, use a device which is able to disconnect the disconnection of the circuits and also an audible alarm for disconnection. Third parameter will be circulation. That is to ensure adequacy of patient's circulatory function during all anesthetics. Methods is to continuously display of ECG and BP and heart rate at least at 5-minute interval, and palpation of peripheral pulse, evaluation of the quality of the pulse, auscultation of the heart sounds, pulse plethysmography and oximetry. Monitor when the patient has invasive blood pressure monitoring, monitor the days, and even ultrasound peripheral pulse monitoring. Fourth will be temperature. The objective is to aid in appropriate body temperature during all anesthetics, and method is to continuously monitor patient's temperature and record on anesthesia record. That's all.
Yes. Where did you prepare this answer from?
From Kaushik Jyotinath, sir.
But there is an article in the anesthesia journal anesthesia, which is published by the Association of Anesthetists of Great Britain and Ireland, where they have given guidelines for minimum monitoring standards once in 2015 and then revised and updated in 2020. Okay, so I think that will be a better answer than this one. So I'll just show you that.